I often get asked who is the best person to consult with if, for example, you are considering seeking medical help because you suspect that you may have mental health conditions or even struggling with life in general. Of course, it depends on the context. If the situation or the symptom is severe, again, I highly recommend for you to immediately go and seek psychiatric help or even get yourself admitted to the hospital. But if the concern is not so severe, for example, for students, I strongly recommend for you to talk to your school counselors. They are trained to be able to advise you on, the process that you should undertake to get immediate help. If you are an adult, you can actually also mention some of your symptoms with your general practitioner or your family doctor. They are able to prescribe you with mood stabilizers, antidepressants, or even, medication for sleep if that is a concern. And they can also provide you with a referral letter to a psychiatrist so that you can immediately get help. Ideally, I would also encourage you, if you can, go immediately to a psychiatrist because they are medical doctors who are trained, to diagnose and treat mental disorders. They are able to prescribe you with the medications that you need, but also advise you with lab tests, to be able to support your treatment, if there is really a concern that you should really pay attention to. You can also go to a psychologist. They are trained to provide psychological testing and also assessment that can, again, determine whether there is a mental health concern. And typically, psychologists and psychiatrists work together to provide support to a patient. Or you can also go and see a counselor or a therapist. They are trained also in the area of recognizing mental health concerns, and they can also advise you on which process to go to. So there's really no hard and fast rules. You can immediately go and see a therapist, or you can immediately go to a psychiatrist. But the best approach that I always recommend is a multidisciplinary approach, whereby you have a doctor, you have a psychiatrist that looks into the medication, the biological aspect, and then you also have a therapist, which can be either a counselor or even a psychologist to provide therapy support for your mental health concerns.